another episode of Bula Wellness on FBC TV. I'm your host, Dr. Neil Sharma. I acknowledge all our viewers from across the country. If you're from the West, the North, the Outer Islands, and not forgetting the great central and eastern corner of our beautiful nation, welcome. This week, we are talking about antibiotics. Antibiotics was introduced in medicine in the 1940s. They have been central to healthcare. Their role has extended from treating severe infections to preventing infections in patients undergoing surgery, protecting cancer patients, and the immune compromised. More recently, promoting growth and preventing disease in livestock and in other animal foods. Once treatable infections are now becoming difficult to cure, raising costs to all concerned. Decreased antibiotic effectiveness has become a major threat in all countries, including the sophisticated and wealthy. Many bacteria are now resistant to several antibiotics. This resistance is directly associated with its use and abuse. Superdrug pugs are a reality of the future. Why are we facing this problem with antibiotics? Firstly, there is greater demand for antibiotics as income level of people increases. Secondly, the increasing demand for animal protein. We note commercial, large-scale animal food production resulting in greater use of antibiotics in agriculture, again driving antibiotic resistance. The most recent State of the World's Antibiotic Report 2015 outlines the importance of measures to act nationally in addressing the antibiotic resistance issue for each country. In Fiji, 20% of our antibiotics is used in hospitals and other healthcare facilities. 80% are used in the community, either prescribed by general practitioners or purchased without a prescription by patients and relatives from some of the 60-odd retail pharmacies. Over half the community use is not needed for coughs and colds, adding to the burden of antibiotic resistance. Hospitals generate most of the most dangerous and difficult to treat infections due to the heavy usage, especially in Fiji. Agricultural use of antibiotics is a reality as we move into a degree of prosperity. Increased population growth drives increased animal protein needs. Farming becomes large-scale, commercialized, and the need to fatten the birds, the pigs, and the cows is profit-driven. The risk of infection in a large population of animals results in antibiotic use and its abuse. Milk, animals, meat, eggs carry antibiotic resistance, and the farm workers and the environment are contaminated as a result. With improved farming techniques and where antibiotics have been withdrawn, antibiotic resistance can be reversed as noted in several developed countries. At the WHO meeting in 2015, Fiji endorsed the Global Action Plan on Antibiotic Resistance. There was a call for all countries to adopt national strategies within the next 2 years. You can see a global problem unfolding before your eyes, but local issues, if addressed, will help slow, stall, and can reverse the subject of antibiotic resistance here. We sent a team out to find out just how much you know about antibiotics. Let's have a look.
Of medication that we can take to maybe fight the bacteria, the harmful bacteria in our bodies.
Helps fight bacteria, so it comes in forms like pills or syrups or cough mixtures and all that.
My understanding is The prescribed medicine that is given by the doctor for us to take when there is a problem with us, suffering from any flu or disease.
It's some kind of tablet.
Antibiotics are things that we take to combat diseases in the body.
The thing is, when I started on antibiotics, I used to just, as soon as I'm feeling well, I stop taking it. But then I slowly learned that that's very bad for us, because the doctors prescribed it to ensure that they kill all the harmful bacteria in our bodies.
When the doctor tells you to?
It's always written on the prescribed envelope that always given to us.
I'm not sure about that.
We should simply follow the doctor's advice, because normally they tell us when to start and when to stop.
No.
Some you need prescription, some you don't.
In Fiji, we cannot buy any medicine over the counter without doctor's prescription.
I think you need the doctor's prescription.
Oh, I know that the rule is that you can't buy antibiotics over the counter, but I think there are some that you can go over the counter and ask the pharmacist for it. And I don't know whether that's right or wrong, but sometimes you can get it over the counter.
Interesting feedback and answers there. From this, we can conclude that we need to know more about antibiotics, its importance, and the proper way to use them. To help us understand this a bit more, we are privileged to have the Chief Pharmacist from the Fiji Pharmaceutical Services, Mr. Apolosi Wasanimbola, with us today. Welcome, Apolosi.
Welcome. Thank you, Dr. Neil Sharma. I'm glad to be here this evening.
Thank you for making time for us today. Just to start things off, please tell us just how serious this problem of antibiotic misuse is.
Well, Dr. Neil Sharma, it is a global problem now, and it is a global burden. And as you have said, World Health Organization have taken a big step, a huge step, in making this a big topic that all member states of the World Health Organization must make a positive step in reducing the rate of microbial resistance in every country, and it's also here in Fiji.
Thank you for that insight, Apolosi. We'll go for a short break before we continue our discussion on antibiotic misuse. More coming up right after this. Welcome back to Bula Wellness. Today we have the Chief Pharmacist from Fiji Pharmaceutical Services, Mr. Apolosi Wasanimbola, with us. We are discussing a crucial subject that we are facing today, the misuse of antibiotics. Mr. Wasanimbola, after the WHO 2015 endorsement of the Global Action of Plan, what measures have been put in place?
Dr. Sharma, following that global meeting in Geneva, Fiji straight away developed its national action plan to combat antimicrobial resistance here in Fiji. That is one of the main objective goal for the next 5 years for all member states to develop a national action plan. And I'm glad to say the government have developed this national action plan to have a roadmap on how we can combat national action plan on antimicrobial resistance. Not only that, we have also, through that development process, we invited various stakeholders. We invited the agriculture team, we invited the academics, we invited the private sectors to come and just inform them, first of all, just to inform them about how crucial antimicrobial resistance is globally and also in Fiji. And also to get more information from them on how we can tackle this issue together nationally. We have launched the National Action Plan in 2015. The other activities that we followed from 2015, we continued to have a National Antibiotics Day, which is usually a one-week program in November every year. We have already organized an event since 2015, and it has been a successful activity by the Ministry of Health with our co-partners. We also have worked with the Consumer Council of Fiji in bringing this message across to the public, creating that awareness and information to the people to help them to understand, to make them understand how important antimicrobial resistance is and the impact that it will have in Fiji. We also have conducted survey, as you have reported, in hibiscus, during the hibiscus event, trying to get people's understanding of antibiotics. What is antibiotics? And we got a lot of answers, different answers about their understanding of antibiotics, how they have used antibiotics, and what is antibiotics basically, as I've said before. This is some of the activities that have been carried out since 2015.
Thank you, Pelosi. So really what effectively you have done or undertaken as a ministry, you have looked at the roadmap and you have gone down to the community level to implement educational exercises to be able to address this issue, and this will be ongoing over the next 5 years. That possibly answers my second question of how we can reduce the use of antibiotics. How can general practitioners assist in reducing antibiotic resistance?
We have also created this awareness to the general practitioners, and they are very important partners in these plan activities in combating antimicrobial resistance. That is one of our aims, was to bring this information to the GPs. They have well accepted the information that we brought to them. What we also encourage them is for GPs to educate their patients when they come and visit them. Some patients demand antibiotics. They have self-diagnosed themselves and they have concluded that they need antibiotics. I must encourage GPs that spend time with their patients and counsel them. Infections such as the viral infections, they don't need antibiotics. And this is some of the informations and awareness that we are bringing to the GPs. And also for the patients, for the public to be aware, listen to what the GPs will prescribe for you. They will not prescribe medicines, but they will just prescribe counselings and non-drug treatment. We're just to help them to heal them over their viral infections.
Fine, thank you. Can retail pharmacies be used in a similar manner to reduce antibiotic resistance? Because we have over 60 pharmacists in the country in the private sector, and you have patients turning up and asking for antibiotics.
Definitely. The pharmacies are important partners in this journey, to Dr. Sharma. Pharmacists must also educate our patients. They must teach them and create that awareness about the impact of antibiotics if they take antibiotics without proper prescriptions. And also patients coming to the pharmacist demanding for antibiotics because they have heard from their friends or from their relatives that they had the same sickness they have, and they want the same antibiotics that they were prescribed by their doctors to them. So pharmacists must also resist the urge to sell without prescriptions.
Thank you. Now we'll just change the direction a little bit. Antibiotics is obviously being used in the agricultural industry or agricultural sector. We know that chicken feed and feed for cattle and milking cows and pigs contain antibiotics because of the commercial nature and the large number of animals being bred together. Can our agriculture department be involved too?
Thank you, Dr. Sharma. They have been involved in our process of developing our national action plan against antimicrobial resistance. They have been actively been a part of our various meetings, and yes, we have continued to create this awareness with them. And we are glad from the Ministry of Health and Medical Services in Fiji to have the ministry, the various ministries who are involved in the animal and the plant sector to be part of this roadmap.
Thank you. Now I think the important thing is that educating the public is very, very important. These messages must reach the common person in our community, and the role is to get this message across that antibiotics is not the solution to every infection you have, and they must learn to listen. How can our policymakers in health and agriculture be involved?
Thank you, Dr. Sharma. The National Action Plan is our roadmap. The action plan have 5 objective areas that the government is looking at to combat antimicrobial resistance, from awareness, working with the agriculture sector, looking at our various laws, looking at our academics on how we can bring this message to them. These are some of the policy directions that the National Action Plan is looking at in the next 5 years.
Before you give your last advice to us, would you like to make some comments about superbugs with all the antibiotic misuse and the resistance we are facing?
The World Health Organization have listed some critical superbugs, and these critical bugs list have been shared with all government states around the globe. The reasons, one of the objectives is to create this awareness that these superbugs, antibiotics to fight and to combat these superbugs are becoming resistant. The problem of finding new antibiotics to kill these superbugs are quite expensive. And I think it is one of the main reasons, Dr. Sharma, that we have this National Action Plan, that we don't want these superbugs to be here in Fiji. We want to remain where they are around the globe, and we don't want to introduce here in Fiji. Otherwise, we will be in a state where there will be no antibiotics be able to kill these superbugs.
Thank you so much, Mr. Vosanimbola, for that informative session. I'm sure our viewers have learnt a lot from today's discussion and will play a more hands-on role in creative awareness. Thank you, Apollosi. Stay tuned for more right after this. Welcome back to Bula Wellness on FBC TV. Today we are facing a major global problem, only 60 years since penicillin was discovered. That discovery was a major milestone in medical history. Now we face a constant battle with bugs learning newer skills. to adapt, to evolve new means to oppose our new antibiotics, causing great suffering to an infected patient. It is a very costly exercise to discover new antibiotics. Germs and bugs overcome the technology developed in producing a new antibiotic rather quickly, successfully producing resistance. The result is that the sick patient suffers, even dying as a consequence of the infection. If antibiotics are to remain useful, then we need greater public awareness on proper antibiotic use and not misuse. Here are a few take-home messages for you. So please adhere to these and share them with your friends and family. Coughs and colds are usually due to viruses and do not need antibiotics. Simple health measures are necessary. Home remedies should be first considered. If doubt exists, then a nursing or a medical opinion can be sought. Secondary bacterial infection will require antibiotics. Seek medical opinion surely. Sore throats in kids must be addressed to rule out infections which can lead to kidney and rheumatic heart diseases. We see a lot of skin infection in Fiji, and that needs better hygiene measures in the home. Use of soap and water and regular showers will address some of those infections. Scabies and infected scabies in infants are due to poor hygiene in adults and older children handling infants and toddlers. Use of shotgun medicine must cease. The triple therapy creams and ointments should not be widely used. Too many pharmacy wholesalers import antibiotics, antifungal and steroid items all brewed together as a fix-it-all treatment option. If one needs medical advice, doctors will also need to think antibiotic resistance and not cave into patient demand. Far too many individuals take a few leftover antibiotics and turn up at the pharmacy for more. Pharmacists must stop over-the-counter sales of antibiotics. Hospital teams must be guided by their therapeutic committee, but the supply chain needs strengthening so that doctors are not forced to use whatever is available at that time. That community must refrain from not completing the antibiotic treatment to the full. Save a few for the next time, for a cough or a cold which arrives, and to use expired medicine on themselves or their relatives. This must stop. After this show, have a look at the pharmacy box in your home and get rid of the ones not needed or expired. So make sure you take time out to familiarize yourself with these important points and reminders. If you have any queries, remember there are always health officials available at your local health centers to answer these questions. Unfortunately, time has caught up with us again, and that brings us to the end of this episode of Bula Wellness. I hope you enjoyed the program. Trust you have learnt a few things that could save and change your lives and those of whom you love. If you have queries about the show or the topic today, you can contact us on Facebook, Bula Wellness FBC TV, or write to us at bulawellness@fbc.com.fj. Make sure to join us again the same time next week for our next episode, where we will address the subject of non-communicable heart disease. Till then, good night.